Welcome to Heart Failure Unfiltered. My name is Nick Hartshorne-Evans and I'm the founder and CEO of the Pumping Marvellous Foundation, the UK's heart failure charity. Today, we will be discussing what it's like to live with heart failure, the things nobody sees, the hidden realities of heart failure from both sides of the kitchen table. This is the second episode of a series of 2 podcasts talking to a patient and their partner about the impact of their heart failure diagnosis and how they navigated living with it. Receiving a diagnosis is only the beginning. Patients and carers share what really happens when heart failure enters their lives. This podcast asks one question over and over again. Beat the diagnosis, why being first across the line to detect heart failure matters not only to the health system, but more importantly, the patient and their family.
Can people still live well with heart failure?
Absolutely. Life may change, but it doesn't stop. With the right treatment, the right knowledge, and the right support around you, people can continue to live meaningful, fulfilling lives. It's about understanding your condition and learning how to live well alongside it.
When someone hears the words, "you have heart failure," they often feel frightened and alone. Your support helps us make sure the next patient gets the information and reassurance they need. £10 helps us provide information and support to someone living with heart failure who may have otherwise felt alone. Donate at pumpingmarvellous.org.
Welcome to Heart Failure Unfiltered. My name is Nick Hartshorne-Evans and I've got some great guests with me today. Who did we start with last time?
Me.
Oh, go on then, Julie.
Sorry,
you're Julie, aren't you?
I am Julie. I'm Julie Redhead. I'm Gavin's wife and registered carer.
Yeah, I'm Gavin Redhead. I've been living with heart failure for quite a number of years, and I'm also a patient educator with the Pumping Marvellous Foundation.
So, right, we talk about this a lot. Life after the diagnosis. We talk about the diagnosis a lot, and absolutely that is really, really important. But once you've been diagnosed with it, what's it like living with it? We, our patient community, our patient carer community, talk about the invisible illness. May not put it in those exact words, but people don't spot it, or there's nothing spottable, because it sort of, the only real symptoms are probably swelling, but that's under the clothes, and the breathlessness. But how does heart failure affect everything? So, question, if somebody met you today, what would they never realise about living with heart failure, Gav?
The way it affects you, and it affects every element of your life. So some days you can't get out of bed. You cannot generate the energy to get out of bed. And just getting out of bed and getting down and getting some breakfast or a cup of tea or a lunch, that is the achievement.
If you feel like it.
Yeah, if you feel like it, that is the achievement for that day. Other days, you feel great. You get up, you can maybe get on. You can get some breakfast. You might even get showered and dressed that day. But then suddenly, your battery's drained again. So you've got. Think of it almost like a 9-volt battery, and you've got so much energy in that battery. But some days it just doesn't recharge. For whatever reason, your body does not recharge that battery, and that battery is flat. That means it's going to impact the rest of your day. And I know people get disappointed, but there's many social events, especially when I was at my worst, where I just said, you know, we were geared up for it. We're definitely going. We're going to this event. We're going to, I don't know whether it was a wedding or a party or something. And I've just got to within an hour of going and saying to Julie, look, I just can't do it. I can't physically feel like I can get there.
Yeah.
Mm-hmm. Yeah.
But how do you pick this up?
It's frustrating at times, from my perspective, because I've yet again got to, especially if we were going somewhere and I've got to say, we're not coming again. And you almost feel like it's as if you're making excuses that you don't want to go. Well, yeah, we do, but and trying to make people understand that it's not that we don't want to, it's Gavin physically hasn't got the energy. And
do you think people are dismissive of that?
I think so, because they don't understand that the physical impact. If your heart isn't pumping properly, the sheer exhaustion that causes, people don't understand. If somebody had another condition, maybe like ME or something like that, or where they get very tired, and maybe they understood that, but because it's the heart, I don't think people realise that has an impact on your physical life and how you're feeling. And it's, if your energy battery is rock bottom, nothing left in it, with any other battery, it takes a while for that energy to get back into the battery. Mm-hmm. So it takes longer to recover. And I think that's one of the things that I've had to learn is, if we've had a particularly busy day, I know the next day it's going to impact on Gavin, and we've got to manage that. And I've got to manage that as well. And I might want to keep going, but Gavin can't physically do that. So it has an impact on our lives and has an impact on what we can do. And we've got to be selective. And I think maybe some family and friends maybe don't understand that, or maybe we haven't explained it to them, because we're maybe expecting them to understand it, but we didn't understand it at the beginning. So maybe we need to explain that a bit better.
But how difficult can it be? I like to see both perspectives here, but how difficult can it be to hear, but you look so well?
Yeah, it's not great, is it? You know, like, it's that sign on the toilet door, isn't it? Not all disabilities are visible. As people look at you and they don't see any difference, because I might look a bit grey, or I might look a little bit more tired, but they saw me pre-diagnosis and they see me post-diagnosis, and they go, "Oh, you look great. You know, like, you look well. You must be getting better, or it must be." Yeah, well, today I'm presentable. Today you're seeing me out and about at my top level, at my peak, which isn't a high peak at all. It's more of a hill, but I'm able to do. If you'd have seen me yesterday, I did well to get to the bathroom. I did well to get out of bed and get organised. I ate maybe the one of 3 meals that was put before me that Julie had to do. And again, I reflect back on that carer side. Anything that I'm not doing around the house that Julie would class as a blue job suddenly has become
a blue job.
We have pink jobs and blue jobs, and
nice.
Putting the bins out is a blue job. This is Julie's thing. Okay. But then suddenly they are kind of like purple jobs, aren't they? Because Julie's having to.
Oh my god!
Pink,
blue, and purple.
Is that
any other colour?
But they're kind of blended, aren't they? Into, so Julie's having to pick up slack as well as doing her whatever she needs to do to keep the household running.
But hey, Julie, Gav looks so well. How does that make you feel?
But he's not.
Is that what you say to them?
Yeah.
Like,
yeah.
He's not.
But he's not. Yes, he looks it, but what you see isn't always what you get. And yeah, he looks well, but that's because I'm caring for him. Mm-hmm. But it's also because of the medication he's on. But he's not. You can't see how hard the heart is having to work to make him look good and make him look healthy. But he's not. And I think we're quite fortunate that we've got a caring family around us.
Considerate.
And friends. And considerate, yeah. I have a sister who's a nurse, so she understands. And she's worked in ICU, critical care, so she's
seen it.
So she's seen it, yeah. She's got a good understanding. And I think I think she's probably explained it to some other people as well, some family members. But they are considerate, but they have seen you when you're not feeling great. But it's the wider community, and I'm always ready. Gavin's got a blue badge, and I'm ready for that person who says, "Why are you in that disabled parking space?"
What'd you say? Go on, give us warts and all.
Not every disability is.
Did you think about that, or is this the clean version?
This is probably the clean version, yeah.
All right, okay.
I said, you don't live with it. You can't see it.
Yeah.
Can you see what's inside him? No, you can't. So you can't presume to know. It is a clean version. It's, but... I
wouldn't get on the wrong side.
No. I think I'm very protective though.
But do you feel, because you are a beautiful couple, all right? But, and the way you interact, you know each other really, really well. But do you feel like you're always watching for stuff going on with Gav? You're looking for...
Yeah, and I quite often pick up very quickly if he's not feeling right, and I can tell in his voice if he's taking on fluid. Because I've learned that, and I'm quite in tuned. And yeah, he's my best friend. We have a good relationship. Yes, there's times I could probably happily murder him, but I won't.
Yeah. I mean, we're fortunate. We have a good relationship, and we know, from our patient community, that not everybody has that.
Yeah, care is not a loved one always.
Yeah, but so there's different dynamics in every sort of family, aren't there? And there are some people, some patients that bury their head in the sand, don't want to know, and the carer's doing their best to interact and support that. And it's about what can we do and what can clinicians do to support that family dynamic to make it the best supporting relationship for ensuring that they improve their quality of life for that patient. We don't want to put everything on the carer. There are opportunities, and providing support for the carer. We were fortunate that, Julie went to the carers organisation, our local one, and there seems to be one in most towns, and got formally registered a carer because it brings in special support. It provides access to
peer-to-peer as well.
Yeah, peer-to-peer, but also it gives you a legal status in terms of being able to support things. I mean, we did what most people do when you get your diagnosis. You start writing your will. You get your, we got all kinds of things. Power of attorney,
the mechanical stuff.
Yeah, so you do all the things like, okay, if it does go pear-shaped, this is at least we've got the right things in place, and we can do that. But equally, we don't put as much attention into providing that ongoing support that will keep that. It'll protract that. Dynamic and keep that going for as long as possible to enable you to go through those roller coasters of emotions and those roller coasters of, and here's a new medication for you. This is you're not gonna get on with it for the first 3, 4, maybe 4 weeks. It's gonna affect your blood pressure. It's gonna do this. You might feel nauseous. So there's gonna be all these different dynamics. But Julie's got to support me through all of that, as well as me trying to do that. And I think one of the biggest challenges for me when I got my diagnosis and whenever something, is introduced is that loss of control. That's the biggest challenge. As somebody who's a control freak, somebody who wants to be in charge of whatever we're doing with.
He's actually admitted it.
Yeah, it is
we have it taped.
That thing about what when things are outside of my control, I've got to make sure that I'm influencing whoever's has got the control to support that. And in some cases, Julie, that control and that trust has been handed over to Julie to make sure, and luckily we're in a trusting relationship. And not everybody, as I said before, has that dynamic but we need to provide that support to ensure that that can happen.
Once you started living with it, what was taken away from you?
Besides the immediate things like loss of earnings, that inability to control, to function, to continue living as previously, you've got all these extra people that are coming and getting involved in your life. Whether I'd always controlled how much I went out, how much we did, what we decided
What you spent your money on,
Holidays.
what were important to you, what were family things.
Independence.
So having that ability to determine what you wanted to do, when you wanted to do it, that when that's taken away from you, you kind of you've got to find things to fill that void. I mean, fortunately for me, one of the things I did was, grateful to Pumping Marvellous for being there, is that I became a patient educator with Pumping Marvellous. So, I'd lost all of that special responsibility that I had being employed in the position that I was, advocating for children and young people, advocating for those people that are more vulnerable. And I was able to apply that then to advocating for people with heart failure, living with heart failure. How can we improve services? How can we support carers? How can we make sure that clinicians are aware of the just even the kind way of delivering a significant, such a massive traumatizing diagnosis?
Should I be worried about breathlessness?
Breathlessness can be a common symptom of heart failure, but changes in breathlessness, especially if it suddenly gets worse, should always be discussed with your healthcare team. Has it changed your relationship with your family?
Yeah, I mean, for me, one of the things that I think what I thought of might happen when I got to maybe 70, 80, whereas people, my son and his wife and maybe their children, when I got to that age, would end up having more of a caring responsibility for us. That got shunted much earlier forward.
Yeah.
So having to get my son to come in and paint things or go up a ladder for me because I couldn't do it, and so having to take on some of those responsibility, I think it changes things, and even things like taking me to appointments and supporting me to go on a journey because I couldn't do it or things. So having to be cared for is really difficult.
Before your time.
Yeah.
Yeah. I think it's, it happened a good, 15, 20 years sooner than you'd expect. And it was a time for everybody to adjust, not just us. And I think trying to explain it to our son, that Dad can't do all the things, and we're lucky. We've got a fantastic son who has got caring nature as well, and he'll do anything for his dad. And it's difficult for Gavin to let go of responsibility and ask for help. He's never been one that's asked for the help. He's always been the person there to help someone else. So it's been difficult for him to actually do that and realise that it's not a bad thing to ask for help. He's just got to learn to do that.
I mean, do carers sometimes feel guilty for finding it hard?
Yeah, I think they do. It's because I'm not going through what Gavin's going through. I'm not dealing with the health issues. So there's times that I do feel guilty, and I suppose I've had a grieving process as well that I've grieved for the life we should have had, the things we should have been doing, or the lifestyle that we might have had. But would I change it? Yes, I wouldn't like Gavin to be in the position he's in, but in some respects it made us stop and think what's important. And some of the things that maybe we thought were important at one time, they're not as important. And having that time together, that's much more valuable than having the holidays abroad and
It's a reprioritisation of your choice.
Yeah, definitely. And it's, I think we all had an element of that after COVID and lockdowns, and people reevaluated their life, and we reevaluated it. And I'd rather be in the position I'm in now with Gavin by my side than the alternative is him not being here. Definitely.
I mean, we don't talk about, we're not very good, I don't think human beings are very good at talking about emotions, really, are we?
No.
How much, you can tell me I ain't answering that one, but how, or have you experienced anxiety, depression, grief and fear about what's happened?
Yeah, definitely. And again, I was lucky that my employer has an employee scheme that I can access talking therapy. And I did. I've accessed it a couple of times. And early days when Gavin was going through the early stages of heart failure, and later on when he went through his transplant, I accessed that service with work. And it's seen in the past as taboo that you don't say, oh, you've had therapy. And it was one of the best things I've ever done, to actually talk to somebody that isn't involved, that can listen to you and help you manage. And it was actually it was the therapist that actually said, it's a grieving process. You're grieving for the life that you had and the life that you should have had. And that's, I hadn't thought about it that way at the time. And I thought, yeah, you're right.
You know, this may sound a bit blasé and a bit like, but do you think that's why travel insurance and things like that become really, really sort of important?
Yeah.
Because it prevents people from continuing the life that they had. Mm-hmm. I know that's a bit of a but we see that all the time.
Yeah. We haven't been abroad since Gavin's had his transplant, and we're planning on going later on this year, hopefully. I hate to think what the travel insurance would be now.
Well, you know where to go.
Yes.
Yeah, go on to the Pumping Marvellous.
Pumping Marvellous, because they have great resources.
There are other insurance policies available, and we don't insure. Yeah. But there's a great way to
resources.
Put your details in, and it's a bit like like a meerkat compare type thing.
Yeah.
It gives you.
Yeah.
Yeah.
But yeah, it's. I'm not ashamed to say that I needed that extra support, and I am so glad that I did access it. And I don't think we should. It's like I say, it's always been a bit of a taboo in the past that you don't talk about your emotions and you don't say that you've been. I had anxiety, depression. Yes, I've had medication to help me through, but that's what I needed to help me, and I'm not ashamed to say it. It's
Yep.
Do
you think it's recognising it?
Yeah, absolutely. Recognise that,
and it's not just the physical symptoms, is it?
It's the
you see Gav struggling, and I can see myself and many other people I know. Yeah. How do you interject as a carer?
Yeah, it's it's difficult, and
because they're not asking for it, are they?
No. And it's what help and support they want. So you've got to have that honest conversation with them. It's what do they want help with, and what advice do they want from you. It's if you've got that good relationship with your partner. There's times where I've got to step in as the carer, and quite often Gavin hasn't physically got the the mental capacity or the physical capacity to fight with maybe the doctor's receptionist about some medications, and that's where I step in. Because they won't mess with me. So I will step in and be strong. It's sure. Yeah, I'm probably blacklisted. But I will fight his corner if I need to.
I mean, how important has it been? This isn't about what we do as a charity. The main thing I see is what we do as a charity, which is connecting like-minded individuals and heart failure, people with a diagnosis of heart failure, or those family who need support. So this is about pumping Marvellous, this question, but how important has it been connecting with other people living with heart failure? That's a question for both, really.
Yeah, for me, like we've discussed it many times before, that people, the general public, don't understand heart failure. We get a diagnosis and we don't fully understand it until we get much further down the line. So if there's no awareness in the general public and we're not getting access to support networks and special nurses, etc., how do we communicate with people, like-minded people? How do we understand? And it's about identifying who your tribe is now, isn't it? And your tribe is...
Yeah, I love that. I'm going to use that.
Yeah, your tribe is now heart failure patients and carers, isn't it? They're the ones that can understand what it is that you're going through, what you live in day to day. And that's the value of having something like the closed network that we have for patients to open up, because many times I see it that I couldn't say this to anybody else, but I just wanted to say it. I needed to say it, but I know I can say it on here.
Because I know you guys understand.
Yeah, you understand, and we know it's in confidence, and you know that I know that you're not going to come back at me. And it's that thing we say about, and Julie gets annoyed at this, that quite often if people ask me, I say, yeah, I'm all right. Because it's easier than being that whinging person that says, oh, well, actually, have you got 10 minutes? Sit down and I'll tell you everything that's going wrong today, and I'll tell you what I had to do yesterday and all the tablets I have to take and that. If people are genuinely interested, then we'll have that kind of conversation. But most often people go, I didn't actually expect you to respond. I just wanted to go. I just wanted to kind of offer and say, oh yeah, how you doing today? I wasn't really expecting a response and you to tell me how you were feeling. So that's me saying, yeah, I'm all right. And I know where I get it from. My dad was exactly the same. And I don't know whether it's a gender specific thing, but I think personally that men are worse about opening up. Not only how they're feeling, but how mentally they're feeling.
Yeah, I absolutely agree.
Yeah,
and also, if you have a look at sorry, Julie, just if you have a look at the statistics of male, female, and who interacts with our website, who interacts with our Facebook group, who interacts with our social media, who interacts with us where we can measure it, it is absolutely 70% women, 30% men. It's really scarily consistent. There's never a 50-50 or a 40-60. It's 70-30
But
always.
in terms of diagnosis, it's not skewed that way, is it?
No, it's not. No.
But it's, I think some women, I think they find it easier to talk about these things, but it's not just with regard to heart failure, it's anything at all. Look how long it took me to get Gavin to go to the GP. It was months of nagging him to go to the GP, and it is a male thing that they don't like to, and maybe men need to get more in contact with their feminine side and don't be afraid of doing it. I think it's you're brought up quite often. You've got to be that strong man, and if you go to the GP, are you admitting some sort of failure, defeated? And it's not.
And it gets to the point where you can't breathe. You've got to do something.
Yeah, absolutely. Yeah.
Yeah.
It's with regard to the support, having from a carer's perspective, having like-minded people on the Pump and Marvellous page it's so beneficial, because nobody else gets what you're going through. Family, the best will in the world, or friends, they're not living it, whereas other carers on the Facebook page, they do get it. Everybody's journey is slightly different, but we're all going through that dynamic of going from partner to, because the majority of them are partners that become the carers. We're going from that dynamic into a caring role. Like I said, we've not asked for that, and how we manage that and how we deal with that, it's difficult for some people.
So the world is your stage. So the question would be, what would you say to another family beginning this journey? What nuggets of lovely information could you
go on to the Pump and Marvellous website, read the resources. If you can join the closed group as carer or the individual, get the information from reputable sources, not Dr. Google, because it might not be accurate.
Or up to date.
Or up to date, yeah. Get the information. It's been developed by patient educators, people that know, professionals that are working. Get that information. It's not the end. Diagnosis isn't the end story. It's just the start of a new chapter, and that chapter can be really good. You can live really well. Just get the information and know what you need to do. Get on the medication, cardiac rehab, or they call it the 4 pillars, or is it the foundation, the cardiac rehab. Try and get onto that. It's all these little things that are available to help you live a better life, because you can do. Gavin went from not being able to lie down and breathe and not be able to sleep to walking a marathon. I drove the marathon. I was the car backup, but it's amazing. I couldn't have done that.
You outpaced 2 cardiologists, didn't you?
Yeah, he did. It's 2 cardiologists.
One was on ibuprofen by the end of it. I don't know. I think the other one felt as though she may. Yeah.
Yeah, I think they both would have given up sooner. But when you're being outpaced by a heart failure patient, they couldn't for shame give up. But and I think that helped. When Gavin went on later, that when the cardiologist saw him at his very best, because he was on all the pillars, the 4 pillars, and he was on all the medication, and he was listening to his body, to then being in the waiting area at the hospital, saying, when she says, "How are you doing?" "I'm fine." And I'm saying, actually, no, he's not fine. And saw him at his worst again. And we were able to get that treatment quickly for the next stage of his heart failure journey.
Yeah. I mean, I'd echo everything that Julie said. And I think the only thing that I would add is that be open and honest about how you're feeling, especially from, a male patient. Be open and honest about how it's affecting you, whether that's talking with your partner, talking with your family, talking with your clinical support team, heart failure nurses, cardiologists, whoever's providing GP, whoever's providing that support. Be open and honest about the impact it's having on your quality of life and the support that you need when you need it, and making sure you can access that. I think it's so important that to keep that family dynamic strong that you have those conversations and you agree what you're going to do about it and what next steps and what things, how you alter your lifestyle to maintain a reasonable quality of life. It might not be as brilliant as it was. And as Julie said, it's the new chapter, it's the new you, it's the new family, it's how it's going to go. You can still live a good quality of life. You just got to find that your way through to that.
And if you haven't got that support facility or that family around you, then you've got a tribe.
Yeah.
If you search for Help for Hearts on Facebook, you can come and join our group if you've got heart failure or a family.
Phenomenal resource. I can't,
I'd love to find out actually its totality of impact.
Yeah.
I don't think I daren't say, oh, how have we helped you? Because I'm not that sort of person, really.
No. But we see it. We see quotes. We see people that, put a question on there. They're about to have a procedure. They're about to receive a new treatment. They're about to get a new medication. And they come back and a week later they go, oh, I really appreciated the support. You put my mind at ease. The treatment that I've had, the procedure that I've just had, you made it much easier for me, that journey. And I think there's lots of nuggets in there that, you could value that. And I think,
I wouldn't, I'd go as far to say that, would I? Okay. We have absolutely improved through the peer-to-peer support, absolutely improved people's quality of life.
Yeah.
And actually, I think we'll have lengthened their life as well.
Yeah.
And I always say the most stable heart failure patients, if you can have a stable heart failure patients, are our patient educators because they're deeply entrenched with conversations and know who to ask.
Yeah.
So anyway, another session of Heart Failure Unfiltered. I felt as though we were maybe going towards some tissues, and I've got an idea what we can do next time with some tissues, because it is an emotional time of people's lives, irrespective what the diagnosis. But heart failure, it does have that tag of heart failure, and it is a difficult diagnosis. And when you don't know what it is, then it's even more difficult. So thank you very much for joining me. And I look forward to inviting to more podcasts, as you can appreciate.
Yeah.
Take care.
Thanks.
Thanks.
Thank you very much for listening to Heart Failure Unfiltered. We've had a fantastic session. We hope you've enjoyed it. We'd be really pleased if you could go to the Pumping Marvellous website. Just put Pumping Marvellous Foundation into Google and we're there. And it's www.pumpingmarvellous.org. If you need help at all, or if this has affected you in any way, we have a peer-to-peer support group, and all you've got to do is search Help for Hearts in Facebook. You apply to come in because we only look after people with heart failure and their carers, and come and join our tribe.